It's 1 o'clock in Zimbabwe's capital, Harare. Welcome to ZTN News Blitz, our top stories. Last dish race at Beitbridge border post as South Africa lockdown nears. Air Zimbabwe suspends flights over coronavirus. South Africa lockdown starts. Coronavirus. Kenya not leaving anything to chance. Now today, like many other days, Beitbridge border post is a hive of activity as Zimbabweans dash to Musina, a town in South Africa's Limpopo province, to buy foodstuffs and other essential goods. Zimbabwe and South Africa will at midnight jointly close Beitbridge border post to non-residents, with only Zimbabwean residents allowed to travel north and South African residents to move south. Cargo operations will not be interrupted. Now, the Zimbabwean travel ban was announced on Monday to manage COVID-19. ZTN correspondent Tupeo Mulea gives us more.
It is people are in a last-minute rush to get essentials and groceries from South Africa ahead of the deadline at 12 midnight. But relatively, the traffic is not that much as one would expect on a normal day. But well, there are people. Not much, but it's a hive of activity. People, they want to go early and come back early before the full lockdown, which has been proposed by the South African government.
The Harare City Council has launched an investigation into the death of Zororo Makamba. Makamba, who was the second Zimbabwean to test positive for the virus, died on Monday. There were reports suggesting that his family was unhappy over the manner in which he died. They claim medical personnel were negligent. Harare City spokesperson Michael Chideme spoke to ZTN.
Yes, Harare City Council is instituting investigations into what happened at Wilkins Hospital when the late Mrs. Zororo Makamba was admitted. The investigation follows comments by the Makamba family of allegations of impropriety in the manner the patient was handled. But whilst we're doing that, the mayor will also be visiting the Makamba family to hear them out and to address any pertinent issues arising from what could have happened at Wilkins.
Zimbabwe's national carrier Air Zimbabwe has thrown its revival plans out of the window and suspended all flights with immediate effect. Like any other responsible organization, the health and welfare of their staff is paramount. The coronavirus has claimed 1 life so far in Zimbabwe, and 2 cases are currently under care. The airline, however, said flights between Harare and Dar es Salaam will continue until March 28 to assist returning residents. COVID-19, now classified as a global pandemic by the World Health Organization, has seen over 30 flag carriers grounding flights and suspending operations in an effort to curb the spread of the virus across borders. The carrier suspended its Harare-Johannesburg flights yesterday. Now, as the coronavirus reality sinks in, one of Zimbabwe's biggest referral hospitals, Parirengatwa, only has 5 functional ventilators. Ventilators are designed for breathing for patients who are unable to breathe effectively on their own. They essentially help a patient's lungs. Authorities and private players have combined efforts to ensure more equipment is mobilized. Today, government received a ventilator from private players, and the 30,000 United States dollars ventilator handed over by the Zimbabwe National COVID Action Trust will be installed immediately at Wilkins Hospital. More ventilators and equipment are expected. The virus is lethal and requires all hands on deck.
And I think that we are delighted to be able to make a contribution to the fight against the global pandemic of COVID-19. We are not the donors. We are a conduit for donors to be able to contribute to the fight against the pandemic in Zimbabwe. So we'd like to thank all who have contributed, and we are here to just represent the people who care about Zimbabwe and want a channel to be able to help.
Now, South Africa begins a 21-day lockdown at midnight today, aimed at stopping the country's rising number of coronavirus cases, which as of Wednesday was 709 confirmed cases, which is the highest on the continent. Health Minister Zweli Mkhize said he believes it may be at least 2 weeks before the lockdown affects the rise in cases. South Africans in healthcare, law enforcement, food sales and distributions, as well as utilities, are exempt from the lockdown. Officials are urging others to only go out for essential needs. Now, in an apparent effort to discourage mass hoarding of food, Agriculture Minister Toko Didiza announced that the country has adequate food supply for the duration of the lockdown. We move on to Kenya, where, like many other African countries, it's not leaving anything to chance. President Uhuru Kenyatta says his government will introduce punitive measures against people who do not want to be tested.
At this juncture, I cannot but continue to emphasize the need for each and every one of us to follow the protocols that have been laid out by the Ministry of Health. Most importantly, with regard to the danger posed to our population by people who flagrantly refuse to adhere to the laid down protocols.
And that's all we had for you this afternoon on ZTN News Blitz. We're back again at 4 p.m. Thank you for watching.